The race is on to develop a vaccine against the deadly coronavirus. Hi there, once again, I'm Jeff alongside the producer JR, and this is episode 230 of Plain English. You can find all the episode resources for this episode at plainenglish.com/230. Coming up today, the deadly coronavirus that broke out in the Chinese city of Wuhan has researchers scrambling for a vaccine. But if history is any guide, that could be several years off. Plus, we'll talk about what it means to put something in perspective. Drug makers around the world are scrambling to develop a vaccine for the deadly coronavirus. The virus first appeared in a meat and fish market in the Chinese city of Wuhan and has since infected hundreds of people, killing dozens of them. Cases have been discovered in nearby countries and as far away as the United States. Governments are working urgently to contain the spread of the virus. In China, transportation into and out of the city of Wuhan is restricted, and airports are performing strict screenings of passengers from that area. The current epidemic has echoes of previous epidemics like SARS and avian flu. A variety of companies and nonprofits have begun work on developing a vaccine. Some of these efforts are private, while others are government-led. A Norwegian nonprofit called the Coalition for Epidemic Preparedness has given $11 million to 2 biotech firms and 1 university, alongside an ambitious challenge to develop a vaccine in just 16 weeks. To put that in perspective, vaccines for new viruses usually take years to develop. The only approved vaccine for the Ebola virus was developed by the Public Health Agency of Canada and Merck, a big drug maker. It took 2 years to be proven 95% effective. The companies working on the coronavirus vaccine expect that they might have a vaccine ready for human trials in a few months. It would take much longer for a vaccine to be approved for widespread use. The new virus belongs to a family of viruses that also includes severe acute respiratory syndrome, or SARS, which struck in 2002, and Middle East Respiratory Syndrome, or MERS, which struck 10 years later. There are no vaccines for either SARS or MERS. A SARS vaccine was developed quickly in 2003, but has been discontinued since that virus has not reappeared in years. The information from the development of that vaccine will give researchers a head start on their work now. There are other reasons to be hopeful. Vaccine technology has improved in the almost 2 decades since the SARS virus broke out. For much of history, vaccines have been weakened or slightly modified versions of the disease itself. The purpose of those vaccines is to train a patient's immune system to fight a similar-looking virus so that it knows to fight the real one if it arrives. Today, one of the biotech firms is trying a new approach via DNA. With DNA vaccines, researchers are trying to discover how human DNA fights the virus. The vaccine will then preempt the virus by prompting the patient's body to overproduce the proteins that can fight off the virus. This is the approach that one drug company used to develop a vaccine against the Zika virus. This approach has one key advantage. Researchers don't need a sample of the virus to perform their work. Passing samples around has its limitations. Enough samples have to be collected safely, and they have to be transported and tested in laboratories. With DNA vaccines, researchers can study the publicly available genetic sequence without needing a sample of the virus. The resulting vaccine won't contain the virus, which should make the trials safer and improve the vaccine's effectiveness. But DNA vaccines are still in their early days. No DNA vaccine has been approved in the United States, admittedly one of the world's strictest approvers of drugs, but they haven't been tested on a large enough population to prove their effectiveness in a real-world epidemic. Developing a vaccine is just one piece of the puzzle. Governments and drug companies have to weigh the urgent need for a vaccine against the imperative to perform extensive testing to make sure it's safe. Once a vaccine has been approved for wider distribution, it has to be manufactured in large enough quantities. While manufacturing is ramping up, governments have to decide who gets the amount that is available. Frontline healthcare workers are usually the first in line. In the absence of a vaccine, health systems have to focus on containing the virus's spread. That starts in hospitals. Health departments around the world are issuing guidance to doctors and nurses with strict protocol to follow if someone shows symptoms of the virus. Hospitals are establishing isolation rooms, strengthening their infection prevention procedures, and educating the doctors and nurses on the front line about the symptoms of the disease. Hey, we'd love to know what you think of the program. JR and I have posted a listener survey online, which you can take at plainenglish.com/survey, SURVEY. It's not only a great way to help us out, but it's also a good way to practice your reading and writing. So as a special thank you for your time, we'll give you access to a free video lesson from me. You'll get that as soon as you press submit. So help us out and go to plainenglish.com/submit survey, S-U-R-V-E-Y. Today's expression is to put something in perspective. In the first part of this episode, I said that the Coalition for Epidemic Preparedness has challenged several biotech firms to develop a coronavirus vaccine in just 16 weeks. To put that in perspective, it took years to develop the Ebola virus vaccine. When you put something in perspective, you take something that's usually difficult to understand and you compare it to something else. By putting something in perspective, you help your reader or your listener understand something better by making a comparison with something else. Now, a lot of you are doctors and scientists, so you know the amount of work required to develop a vaccine. But if you're like me, then you probably don't know much about how long this takes. If I say that drug makers are trying to develop a vaccine in 16 weeks, that sounds fast, but is it really fast? I mean, what's normal? Is normal 16 weeks, 16 months, or 16 years? I really don't know. I need to put it in perspective by comparing it to something else. The Ebola virus vaccine took 2 years to develop. 2 years is more than 100 weeks. So now you know more about how fast 16 weeks truly would be. We have put it in perspective. I'm considering switching website hosting companies in the next few months. It won't affect any of you, except that the site will hopefully be faster. But I've got to make sure that I make the right choice and that I know how much each plan will cost. Now, one plan includes 10 gigabytes of storage. Is that good? Do you guys think that's enough? I didn't know. I had no idea if 10 gigabytes is a lot, a little, or what. To put that in perspective, I looked at my current cPanel, the back end of my website, and I discovered that I'm currently using about 5 gigabytes. So that puts things in perspective. Now I know that 10 gigabytes is probably enough for now. And as I'm comparing the plans, I'll look to the next highest plan so I know how much the price will go up when I exceed 10 gigabytes, maybe in another year or two. I find that to put something in perspective is often used when there are numbers and when the numbers describe something that we're not familiar with. How many weeks does it take to develop a vaccine? I don't know. How many gigabytes of storage do I need on my website? Again, I have a general idea, but I don't really know. Here's another example. About 16 million acres have burned this year in Australia. That's a lot. We know that's a lot. But do you really know the scale of this disaster? I mean, weren't there wildfires in California last year or the year before? Weren't there a lot of fires in the Amazon last year? So is what's going on now in Australia worse than what happened in California or Brazil? Is it about the same? We don't know. Let's put that in perspective. The worst wildfire season in California's history was 2 years ago. 2 million acres burned. Last year in Brazil, about 2.2 million acres burned in the Amazon region. Now, in Australia this year, it's 16 million acres. That puts it in perspective. When you heard me say that 16 million acres burned, you probably thought that was a lot. But when you first heard me say that, did you know that was more than 7 times worse than what happened in Brazil? Probably not. We don't think about these numbers too much, so it's easy to lose perspective. That's why we need to put these numbers in perspective to fully understand them. One thing that makes me laugh is when people complain about the price of gasoline going up by, 50 cents or $1. And I don't want to discount the effect that higher gas prices have on people's budget. That's not my point. My point is this. Let's put this in perspective. A gallon of gasoline in Chicago today costs about $2.75. A gallon of milk costs about $4. Think about what it takes to get a gallon of gasoline into your car, and the fact that this all happens for $2.75 is nothing short of a miracle. The process of getting milk from its source to your table is a lot simpler than getting oil out of the ground, refined, and into your car. So when people complain gas is up by 25 cents, I just put it in perspective by comparing it to how much they pay for a gallon of milk. And don't get me started on how much people pay per gallon for bottled water. That's worse. Okay, as I was writing this article last Sunday, news broke that the basketball star Kobe Bryant had died in a helicopter crash. And I was reminded of a quote of his from a few years back. So I looked it up, and here it is. Everybody loves winning, but not everybody loves the process of getting to the win. That's for sure. Kobe Bryant had a famously strict work ethic, which paid off in his legendary basketball career. Especially with sports, it's easy for us to watch TV and not quite realize the amount and intensity of work that goes into it. So here's that quote from Kobe Bryant once more. Everybody loves winning, but not everybody loves the process of getting to the win. That's it for today. Thanks for joining us. Last week, I dropped a hint about a new episode topic. I said that it's about the number 98.6. Have you figured it out yet? If not, I'll give you another hint. Maybe you aren't familiar with 98.6. Maybe you're familiar with the number 37. So if either of those numbers mean anything to you, then you'll want to listen on Thursday because there is some surprising news about those two numbers. If you don't know what those numbers are, then you'll just have to listen on Thursday and find out. Remember to fill out the listener survey at plainenglish.com/survey. It's not too long, don't worry, and you can take it very easily from your mobile phone as you're commuting to and from work or waiting for an elevator or whenever you have a few minutes to spare. plainenglish.com/survey. And everyone who fills it out will get instant access to a free video lesson from me. So how does that sound? Not to mention, you're helping your favorite English podcasters at the same time. So do that now before you forget plainenglish.com/survey.